Okay, another ugly side of nursing, and it's actually a pretty ubiquitous topic, especially for nursing. A lot of people kind of think of it when they think of nursing, and it's poop. Talking about poop. Um, Let's talk about excrement and a whole bunch of things, but we'll other excrement. I mean, urine, and all that. But we could just leave it to poop right now because it's a big enough topic on its own. You will have to deal with poop. You definitely will, at least in nursing school. Maybe you'll get to a point or find a job that you don't have to deal with it every day. But in nursing school, yes, you have to deal with poop. Bedside being probably 80% of the marketplace, you will be dealing with a lot of poop then. And it's important because, all these body functions tell us indirectly or directly, urine being indirect, cardiac output, but poop gives you some direct knowledge of the body's going on. If it's dark poop, it might be a intestinal bleed, an upper GI intestinal bleed, a frank one might be in the sigmoid, or you can see right away if it's hemorrhoids or lower GI and stuff like that. Parasitic, just how it's formed, the shape of it, the coloration of it. It might tell you give you an idea of blockages or polyps or something like that. There's a lot you can learn from poop. All right, so smell. It can go on and on. All right, like my kids say, Dad loves to talk about poop, and that was before I was a nurse. So, it is something you guys have to handle. You're gonna have to handle. Please glove. And if you're wise, you'll double glove. Because I have seen gloves break. Fairly recently, I had a friend of mine, a very experienced nurse, probably, one of our charge nurses, probably 10 years now, nurse. She's a young lady too, but she became a nurse relatively early. Cleaning a patient, finished up, and discovered her glove had split open in a couple of, she just didn't notice. Yeah, bleach wipes. She almost lost her lunch. Not a good thing. For me, yeah, I don't want to touch poop either, especially any other people's poop. But, you get a certain amount of resistance to it, having raised kids yourself. I raised all my kids, took care of them as babies, changed diapers. I was like a NASCAR pit crew, or a NASCAR shit crew. Just no problems. Very quickly, I was very efficient and quick. And boys and girls are different too. One's waterproof, one's not. Boys are easy, actually. You just dunk them and they're clean pretty much. Girls have to, there's nooks and crannies, Ugh. So, and you're going to be dealing with nooks and crannies, or adults and just interesting anatomy too when you're cleaning. So just be aware. You also have different types of orifices coming out with poop. I've had many different orifices come out with poop, and you're gonna have to deal with people using poop as a weapon, as projectiles, as a snack, as a artistic device, as a pool of scrying, telling the future. I had one patient just kind of had a big puddle of poop. It was just, maybe they're seeing some future in it, or some kind of thing, or maybe they were just really proud of it. Couldn't really tell. I was just very happy they didn't throw it at me. Just scoop it up and. So be aware. Poop gives a lot of information, but it's something to be very wary of. Okay. Also, there are various diseases you don't want to be touching it, and so actually COVID is a good thing in the sense that you mask. So I would still recommend masking all the time, and maybe some glasses or eyewear. So I know a lot of people that pretty much go in like astronauts, and I'm like, okay, that's a little over the top, but different people have different levels of tolerance for poop. So good luck out there and be aware. Okay?